Congressman Sestak, the question is, what is your position on the healthcare reform bill, and do you support a public option?
I'm 150% behind it. We were the first committee, actually Ways and Means beat us by a couple hours, to get it out of our committee. I purposely went to the Health, Employment, Labor, and Pension Subcommittee of Education Labor, so it would have to go through my committee. I'm 150% behind the public option. And here's why. You know, it's right that we cover the uninsured, but it's also economic sense. We lose $100 billion every year, according to the Institute of Medicine, of economic output because of the uninsured. That doesn't even count the 82 million who lose their health care 1 or 2 months of the year. But the public health care plan option is a necessity. You sit in Pennsylvania right now. 2 insurance companies have 70% of all health insurance plans, private. That's a duopoly. It's a cartel. The public health care plan option says, you know, there's a big market private industry out there, 47 million unemployed, uninsured. But we're not just going to give them to you. We're going to make you competitive, because we're going to have a public health care plan option where we're not paying $23 million to a CEO or $70 million severance pay like we just did here, and we're going to make it a competitive field. So this public health care plan option, this choice, is an economic necessity. There's so many other good things in this bill, from minimum benefits, that a woman will have a mammogram at 40 every year, colon rectal exams, glaucoma exams. Why? We're going to let you have free co-pays for those. Why? Not only are you more healthy, but we pay less as society as we bend the cost curve. This is an absolute necessity to get this through.
The thing, though, is when the senator was out here, he would leave everyone with the impression that there's not any difference between you two on this. He says he was out there fighting for the public option all week. Is this not an area of distinction in your view in this race?
I can't speak for Arlen except what he said publicly. I know 8 weeks ago on Meet the Press he said he was opposed to the public health care option. And I gather here and elsewhere he said he's for it. Look, I respect Arlen. You can't be in public service and not respect someone. But he hangs in his office a trophy, which is the poster board of that he and Bob Dole took around this nation, where it said President Clinton's big government health care plan reform. And because that failed, which the Congressional Budget Office said would have decreased cost of premiums 3% and would have reduced the budget slightly, we have had 10 million Americans lose their health insurance since that time. I just know that I accept what he says, but leadership is out there doing it at a moment, not of crisis, but preventing crises. We are in a healthcare crisis. We're in an economic crisis. We're in an educational crisis. Go around these cities, and what you've seen is that promise of the American dream broken, where your children would have an opportunity based on their God-given talents to do better than you. How did we get here? No, it's not just leadership. It should be accountable leadership. So I take him at his word. The point is, we ended up here, and in the Navy, when some ship goes aground, we relieve the stewards, the captains. This future of ours takes new energy and new ideas. Someone who's in it for others, and I want to be in it every day for Pennsylvanians. I owe them for my daughter.
Do you see it?